Are you or your clients struggling with any of these physical or psychological symptoms that just won't go away, especially conditions such as chronic fatigue syndrome, fibromyalgia, and chronic musculoskeletal pain issues? Have you or your clients tried everything but still can't seem to find relief? Well, let me tell you, there might be a significant mineral imbalance at play that is often overlooked if one doesn't use the right assessment to identify it. This particular mineral imbalance is much more common than you might think and could be one piece to your or your client's health puzzle. So stick around till the end to learn what this imbalance is, how it unfolds, why it's important to know about, whether you're a health seeker or a coach or practitioner that supports them. And trust me, you don't want to miss this. And I'm Sarah Korzeniewski, also known as the Organic Dietitian, registered dietitian, functional health practitioner, and transformational coach. And you're watching the Wellness Code Academy channel. It is often said that minerals are the spark plugs of the body because they're catalysts of almost all enzyme reactions within the body. Without enzyme activity, life does not exist. The foundation of health lies in adequate mineral intake and ideal mineral ratios. Achieving this is not just about taking a mineral supplement or popular electrolyte mix. You really want to better understand the role of minerals, test and properly interpret the results ongoing, and learn the root causes of imbalances and deficiencies so that you know which minerals you need to focus on more and what actions to best guide the body back into balance. Minerals are necessary for proper functioning of organs, tissues, and bones, as well as brain neuroplasticity. But when one's stress bucket is overflowing, they can also be stored in places where they aren't supposed to be and cause issues. All minerals have a complex interaction and affect each other. No nutrient works in isolation. Again, another reason to not blindly supplement because you can actually do more harm than good and throw the body further out of balance. When we lose the balance of minerals, it can impact our health in many ways. The specific mineral imbalance that we're going to cover today in this video in the hair tissue mineral test world is known as something called the calcium shell. Calcium is a very hard and sharp mineral. Have you ever seen the white and rough buildup on a water faucet spout? That's calcium. Our bodies contain calcium too, which 99% of it should be in your bones and teeth to help provide structure, or we would fall over and not really be able to chew. When we don't have the proper minerals to help keep calcium in the bones or direct it to the bones, it can start getting pulled from the bones and deposited into our soft tissues. Think joints, kidney, heart, arteries, capillaries, muscles, brain, etc. This isn't where calcium is meant to be. So when this happens, it can lead to inflammation and create many symptoms. Remember, picturing the calcium buildup on this faucet. Imagine this in your joints and in your muscles. Ouch! Or building up in your arteries. Hello, heart circulation issues and heart disease. Higher calcium on an HTMA test needs balancing, but a calcium shell in particular is seen as any calcium level that shows higher than a 165, which you can see one example of here. This is where an HTMA alongside a well-versed practitioner are so valuable and are great tools, as this is rarely seen in the blood. The presence of a calcium shell doesn't create just physical symptoms, but they can also create psychological symptoms as well. Calcium can prevent the movement of emotions in and out of your cells, so it can create a numbing, deafening effect, along with things like apathy, withdrawal, and rigidity. It also dulls the emotional response, while also slowing a previously racing mind down, giving an individual a sense of normalcy as the calcium shell is formed. Though in reality, it may not be a sign of healthy improvement, but rather a coping survival mechanism by the body. The calcium shell is really another way for the body to say, the way you've been operating is not sustainable. It's depleting and it's making you sick. It's time to make some shifts within yourself versus others and making yourself a priority. Rewiring an anxious brain and supporting other emotional symptoms, for one, commands properly addressing a calcium shell. As with every symptom, there are often many root causes. And because mineral imbalances don't just show up, we can't just expect to take supplements to improve them. There are many different scenarios that cause calcium to get moved into our soft tissues, like our organs, our brain, our heart, our kidneys, our joints, and more. A calcium shell can develop for a number of reasons that we must also investigate. I can't possibly list all factors in this video. However, I wanted to give you a couple ideas to start considering today. Stress is a huge factor that triggers the adrenals and causes sodium, potassium, magnesium, and zinc to be lost. And stress can come from hundreds of places, both internal and external. Emotional trauma is one that we see a lot. Remember, when trauma is at play, your body can produce a calcium shell as a protection mechanism to help you not experience those intense feelings. Supplements are actually another consideration as a root cause. And this is why blindly supplementing or not working with the right practitioner that knows their stuff can be so dangerous and costly. We never recommend traditional multivitamins because they really are not customized enough. In the case of a calcium shell, if you're taking supplements with calcium in them, as many multivitamins do, you might be unknowingly causing the problem to actually get worse. Vitamin D is also another popular supplement these days. However, most people aren't talking about the fact that vitamin D actually grabs calcium from the diet. So when you start taking high doses of vitamin D, you can actually accumulate excess calcium, and yes, it can get pushed into the soft tissues. Look, calcium isn't bad. It's an essential nutrient for many reasons. But ultimately, as with many things, it's about balance. Minerals impact every system of the body, which is why they are so important to pay close attention to. Remember, no nutrient works in isolation. They work together in partnership to function well, or they can even play against each other. This is why knowing what you're doing when it comes to mineral balancing is really so critical and so valuable. If this intrigues you and you'd like to learn more and become a master at using this highly valuable and action-oriented lab test with yourself or clients through the lens of working with the body, mind, and spirit system, then our practitioner certification training, Holistic HTMA Pro, is for you. This training will teach the interpretation and implementation of the HTMA test through the lens of psychoneuroimmunology and neurorewiring, which will be a blend and a deep dive into both the psychological and physiological implications of mineral imbalances and how to help clients navigate them and become their own best self-healers. And we're offering a 12-week live beta immersion of this course that will start September 2023 that will be priced at a fraction of the cost of when we release the official pre-recorded version at a later date. If you'd like in on this beta run, reserve your spot by jumping on our VIP list using the link below this video. And if you're watching this video at a time after we release the official version, you can learn more and enroll now by visiting our website. In the video information area, you'll also find links to our 1-year wellness code, holistic healing, wellness, and life optimization practitioner certification program, which includes step-by-step business and marketing training. And our trauma-informed one-on-one functional health and transformational coaching services. Lastly, if you found value in this video and you'd like to see more from us, be sure to like this video, comment, and subscribe to our channel by clicking on the red subscribe button below and clicking that bell next to it so that you can be sure to be notified the next time we release a brand new, super helpful video. Until next time.